Hello, today we're going to discuss why clinical measures are essential in return to play criteria for athletes. So, the first one is objective assessments. Clinical measures provide objective data and assessments that help determine an athlete's readiness to return to their sport. These measurements are based on scientific evidence and standardized testing protocols, reducing the subjectivity in the decision-making process. Baseline comparison. Athletes often undergo baseline testing before the start of their season or competition. These baseline measurements serve as a reference point for evaluating an athlete's post-injury condition. By comparing post-injury clinical measures to baseline values, it helps us assess the degree of recovery with the athlete. Progress monitoring. So regular clinical assessments throughout the rehab process allows sports therapists, rehabbers to track an athlete's progress, monitoring improvements in strength, flexibility, range of motion, and other parameters help ensure that rehabilitation is on the right track for the athlete. Risk reduction. So returning to play too soon or without proper rehabilitation increases the risk of re-injury, which we don't want. Clinical measures help identifying any lingering defects or weaknesses that may make an athlete vulnerable to further injury if they return too soon. Functional testing. Many clinical measures include functional testing that stimulates the demands of the athlete's sport. And this ensures that the athlete can safely perform sport-specific movements and again, reducing the risk of injury during competition or training. The patient safety. The safety of the athlete is paramount, and clinical measures help prevent athletes from returning to play when they're not physically or medically prepared, reducing the likelihood of worsening the injury or causing new injuries. Evidence-based decision making. Clinical measures are based on evidence and research, and they provide a standardized and systematic approach to the decision making, ensuring that the athlete's return to play decisions aligns with the best practices within the area of sports therapy and sports rehabilitation. Psychological confidence. Knowing that their physical capabilities have been objectively assessed can boost an athlete's confidence when returning to sport. This psychological aspect is vital for optimal performance and mental well-being. Athletes like to see the figures, they like to see improvements, and to see that their rehabilitation program is actually working. Compliance. So coaches, athletes and teams are more likely to comply with return to play recommendations when they're based on clinical measures. Having objective data reinforces the importance of following the prescribed rehabilitation plan. In summary, clinical measures and return to play criteria with athletes play a crucial role in ensuring a safe and successful return to sport. They provide objective, evidence-based assessments that guide sports therapists, rehabbers, athletes, and coaches in making informed decisions. And this in turn will decrease the risk of re-injury and optimizing an athlete's physical and mental readiness for competition or returning to training.